Okay, hello guys, myself Mir Mosan. Today I'm going to teach you about bipolar disorder. Okay, so what is a bipolar disorder? It's a mental condition. Okay, so the basic definition of the bipolar disorder is it is a chronic psychiatric mood disorder characterized by extreme fluctuations in mood, energy, activity levels and cognitive functioning. These fluctuations range from elevated mood states to low mood states, that's major depression. Okay, formerly known as maniac depressive illness, bipolar disorder is significantly affecting our daily functioning, or mm, people who are affected by the bipolar disorder, they have very high chances of affected relationships, interpersonal communication, and occupational performances. Okay, so this is the basic. So we are going to deeply understand the bipolar disorder. Okay, so as I said, it's a bipolar disorder is a mental condition that causes extreme mood swings. These include emotional high called mania or hypomania, okay, and lows called depression. It's formally called maniac depression. The conditions affect a person's mood, energy, and ability to function in daily life. Okay, so what are the basic and key effects of it? Bipolar disorder affects about 40 million people worldwide. It's a huge number. 40 million people is a huge number. Okay, so in about not about taking the latest census, but about 2.5 billion people are in the world, and about 40 million people affect from this disease. It's a mental condition, it's a disease, so it's a huge number. It typically appears in the teenage or early 20s. Okay, so basically ये टीनेज में होता है, in basic 20s, or it's also seen in mid adults we can say 30s 35s. So ऐसे एज में भी ये मिलता है. Okay, with proper treatment people with bipolar disorder can lead full of productive lives. Okay, and it's a lifelong condition that requires ongoing management. Okay, so basically it can be treated, but it takes a lot of time. It takes a hell lot of time to get fixed properly and fully. Okay, but we can counter it by continuous and ongoing management and treatment. We can somehow or somewhat lower its effects. Okay, okay. So now we're going to learn about the three main types of bipolar disorder. Okay, so the first is bipolar 1 disorder. ठीक है? It involves at least one manic episode that lasts even 7 days or requires hospitalization. Okay, it that lasts 7 days or requires. So basically, it lasts 7 days. Okay, and it requires hospitalization. Go, it's severe. Most people also experience depressive episodes. Mania may include psychotic symptoms like hallucinations. Okay, so this is most common in age group of 30 to 40s. Okay, this is common in about 40 million people. This is common in which age group? 30 to 45. Okay, then there's bipolar second disorder. It includes one major depressive episode or hypomanic episode. Okay, so hypomania is less severe than mania. People may be depressed for longer periods. Teenage teenage slash 20s or mid adults. Okay, then there is cyclothymic disorder. Okay, it involves periods of hypomanic symptoms and depressive symptoms for at least 2 years. The symptoms are less severe than bipolar first and second. Okay, so this is that most people have. It's less severe, and it affects us, basically it affects us very less. Okay, but it is seen in most people. This is the common disorder that is seen. Okay, so this is this. Now we'll actually see maniac versus hypomanic episodes. What is the difference between these two? Take okay. Uh, Meaning episodes last at least 7 days and cause severe problems at school, work, and social activities, while as hypomanic episodes last 3 or 4 days, cause noticeable change but less severe disruption. Okay, so it's huge problematic, huh? It's common and less problematic. Okay, then there's severity. May require hospitalization, and this is severe. Okay, it may require hospitalization and can include psychotic features like delusions or hallucinations. So, in this, in many episodes, we may require hospitalization, and the most common problem with this is it makes a person depersonalized, or we can say depersonalization. Depersonalization is seen in maniac episodes. Okay, so what depersonalization means? It means you don't really feel things. You feel you don't feel or you don't uh, what we can call it. We don't actually understand our own emotions. We don't feel happy, we don't feel sad, we feel nothing, we feel noneness, we feel emptiness. And that's the severity. Actually, in depersonalization, you think that you are living life behind a window and you are just watching your life as a movie and you cannot do anything to it. Okay, there's a huge problem with this. And in hypomanic, what we see doesn't typically require hospitalization, and does it include psychotic symptoms? That is normal, okay, but it is a condition. Okay, so what's the manic impact? What impact does it cause major disruption to daily functioning and relations with others. Okay, as I said, it's a huge problem, and maybe in this it may be harder to recognize as problematic since functioning is less impaired. Okay, so this is this. Let's move to the next slide, which is manic episode symptoms. Okay, so a manic episode requires three or more symptoms that represent a clear change from visual behavior. So, what does it actually mean? What does this actually mean? A manic episode requires three or more symptoms that represent the clear change from usual behavior. So, in manic episode, we see changes in our moods, in our mood, in our energy, in our daily daily behavior, daily routine. We see change, and when there are 3-4 changes, we name it, or we conclude it as a maniac episodes. Okay, so What is the diagnostic? At least three or more symptoms. uh, Then, what are the key symptoms? We will see the key symptoms. Okay, abnormally elevated or irritable mood. So, the first key symptom that we can conclude from this is abnormally elevated or irritable mood. That is when our mood is very irritable and we fight with people or we have issues with the interpersonal communications. So this is the key symptom of this. And increased direct activity or psychomotor agitation. Okay, we may feel hyperactive. Okay, we may feel hyperactive, and at the same time we feel very low of energy. Decreased need of sleep, we don't feel sleepy. uh, Insomnia, we call it insomnia, we feel less in need of sleep. Inflated self-esteem or grandiosity, we call it ego issues that may rise. Okay. Pressured speech, we may speak rapidly or very slowly. Okay, or excessive talking, we can say. Flight of ideas or racing thoughts, that means we're high on dopamine, sometimes high on adrenaline, which may cause us to which may resent or which usually resents risky behaviors. Okay, so this is this. And this may sound like, okay, these are all good things, we are in a high adrenaline, but no, it leads to severe consequences. Okay, so we can learn here the common symptoms. Okay, what are the common symptoms here? Being much more active or energetic than usual. Okay, as I said, feeling overly confident or having an inflated sense of self-esteem, needing much less sleep than normal, being a usually untalkative or speaking very fast person. Okay, having racing thoughts or jumping quickly between topics, easily being distracted by unimportant things, making poor decisions like spending spree, risky sexual behavior, or foolish investments. Okay. Then there's depressive order symptoms, that is, this is the maniac and this is the hypermaniac. There is depressive order symptoms. Okay, a major decisive episode that lasts 2 weeks and significantly impacts daily life activities. Okay, sorry, I forgot. This is also a maniac. Okay. Common symptoms. What are the common symptoms? Feeling sad, empty, hopelessness, or we can say we feel a persistent sadness, emptiness, or hopelessness, loss of interest or pleasure, change in appetite, weight, sleep disturbance, psychomotor retardation or agitation, fatigue or loss of energy, feeling of worthlessness or guilt, poor concentration and indecisiveness, recurrent thoughts of death or suicide. So, suicide risk is higher during this depressive or mixed episode, but it is less unhealthy, or we can say it's less impactful than maniac episode symptoms. Okay, but this is the thing that we usually don't notice in people, because okay, because these things we often a person often feels it only, right? We don't see, or we are not able to comprehend with the behavior as it's normal, or it's just people suffering from depressive episode symptoms. Okay, so now to the next side, we will discuss what causes bipolar disorder. Okay, so what causes bipolar disorder? There are multiple factors contributing to its development. The first factor we'll say is genetics. The second is neurobiological factors, environmental triggers, medical and medication factors. Okay, so first we'll discuss the genetics. So we inherit So the genetic factors we inherit, 80 to 90% people inherit from their parents. First degree relatives have 10x higher risk. Okay, strong overlap with major depressive disorder genetics. By this I mean 80 to 90% people with the history or with the condition in the family, having a condition in the family, they transfer. Okay, and it have 10x higher risk. Okay, if they are first relatives to you, first cousins, then 10x higher risk. Okay, okay. Having a parent or sibling with the condition increases the risk significantly. Okay, then there's neurobiological factors. What are neurobiological factors? That are brain structures. Okay, neurobiological factors, these are brain structures, or we can say prefrontal cortex. Okay, this is the part of the brain that usually controls our not usually, that controls our mood, energy levels and stuff. So this, if there is a wiring problem, okay, I will brief you on this. If there's a wiring problem, this occurs. This occurs. Okay, research shows differences in brain structure and function in the people with bipolar disorder. These differences may affect mood regulation and emotional processing in the brain, as I said it. Okay, then there are environmental factors, that are stressful life events, sleep deprivation, substance use, I mean drugs, alcohol, and other stuff, and childhood trauma or abuse. That are the environmental factors that we can see, or triggering factors. We may say triggering factors that are like this. Okay, then there are medical conditions. Okay, certain medication like thyroid disorder, multiple sclerosis, or stroke may be linked to increased risk. Some medication can also trigger the mood episodes. Okay, so this is this. And then we're going to look at the statistics. Okay, so 2.8% of US adults have bipolar disorder, and in India it's about 3.7% of Indian people. Okay, 3.7% of Indian people. Okay, they have bipolar disorder, and it's a 3.7 may seem very less, but it's a huge number. Okay, this represents approximately 5.7 million American adults globally. About 40% people live with bipolar disorder. The condition typically begins in mid 20s and affects men and women equally. Okay, got it. Then what are the risk factors? Okay, as we said, uh, genetic factors and life factors. Okay, by genetic factors we mean the family history of bipolar disorder or another mental health condition significantly increases. Children of mothers aged 40 or older may have higher risk having a major depression with ADHD. Okay, uh, depression with ADHD is a risk factor. Okay, so this is this. Okay, life factor. Young age people, particularly under 25 years old, low educational and employment levels, high stress levels, and traumatic experience, substance use or alcohol misuse, major life change, or chronic stress. Okay, so this thing mean causing bipolar disorder. Okay, so as in speaking of India, or usually in mid age, people faced with economic problems, employment problems, high stress levels, maybe relationship issues, or any work related issues, or family issues, substance use, or alcohol misuse, major life change happen in the mid 25s or yeah mid 20s. So this causes or this contributes very very much to what leading cause of bipolar disorder. Okay, so now how is bipolar disorder diagnosed? Okay, we will see how is bipolar disorder diagnosed. The first is we can say detailed clinical interview. Okay, by psychotic therapy or psychiatric therapy we may take. Longitudinal mood history. Okay, over a long period of time you record your what are the mood swings, what's your mood constantly. So longitudinal mood swings, mood history, we may look at it and we may observe a pattern and we can finally conclude whether it's a bipolar disorder or not. Family history assessment, rule out medical causes, thyroid test, neurological exams, and that's already discussed. Okay, and that's what I said already. Standardized tools, example mood disorder questionnaire. It's a question bank where it's it may be directly asked to you or it's usually on a paper. Actually, this questionnaire was found in 1985, somewhat around that, by it was a German psychiatrist and psychologist who founded it. And in this, they ask you very specific and very key related questions to your life and conclude whether you have a bipolar disorder or another mental condition. Okay, and in most cases bipolar disorder is often misdiagnosed as major depression initially. Okay, so this is a thing about bipolar disorder. Okay, so here we will see healthcare professionals conduct physical exams and lab tests to rule out other medical causes or okay. They review medical and family history, mental condition. Evaluation includes discussing symptoms, mood patterns, behavior change. Screening tools like mood disorder questionnaire may be used. Okay, diagnosis follow criteria from DSM-5 or ICD-11. Okay, these are questionnaires, and these no, sorry, these are not questionnaires. These are actually levels. Okay, these are levels in which we can conclude or we see whether the it's on verge of maniac or hypermaniac. Okay, input of helmet is helpful. Okay, this is it. Now on the next slide we will say early warning signs, and these early warning signs are mood change. Okay, sleep patterns, behavior change. Okay. Okay, sudden shift in moods that's outseen of character periods of usually high energy followed by extreme sadness, a change that lasts several days or weeks rather than hours, sleep patterns, needing much less sleep than usually during the okay I already discussed this. Okay, your mood change, you may see high on energy but low on mood change, like that lasts 6 or 7 days or weeks rather than hours. Behavior change, taking impulsive decisions or risky behavior, social withdrawal or isolation, low sleep and other things, inclusion, agitation and irritability. So these are the things that are usually seen in bipolar disorder. Okay, now on the next slide we are seeing the treatment and it's how it's treat and how we can prevent it. No, we cannot actually prevent it, but we'll see. Okay, there are medical treatment. Okay, and there are therapy options. Okay, pharmacological treatment and psychotics. Okay, sorry, I'm flattering. Okay, we may in medical treatment we may use lithium gold standard, valproate, carbenzapine, and lamotrigine. These are the medications that are usually used for bipolar disorder and to actually reduce its symptoms. Okay, and as antipsychotics, we take olanzapine, quetiapine, ariprazole, used for acute mania and maintenance. Okay, uh, so these are two another things we take for its treatment. Actually, we don't treat it, we reduce its symptoms, and we get used to its reduced system. That's, no, we say it's fixed. But actually it's never fixed. Okay, it's a lifelong thing. And then there are therapy options. Okay, there are there is cognitive behavioral therapy, that is CBT, family focused therapy. There are interpersonal and social rhythmic therapy, psychoeducation and support groups. These are things that we can, these are usually talkative therapies. Okay, we take therapy by we may have counselor or parents, friends. These are therapies that that we do orally. Okay, that we talk to these people and try to help them. Okay, and okay, I already discussed in the mood stabilizers and antipsychotic medications. Okay, lithium is one of the most effective and mood stabilizer and has used for decades. Valproic acid and carbamazepine are anti convulsants that also work as mood stabilizers. Okay, so these are mood stabilizers. What they do, they actually reduce your high risk or high risk in taking behaviors and uh, what's it called, uh, and they actually fix your energy levels. Okay, and your mood levels. They try to regulate them and balance your hormones. Okay, these are mood stabilizers. And then there is antipsychotic medications. Okay, second generation antipsychotics like olanzapine, quetiapine, and ariprazole are most commonly prescribed. These can be used alone with mood stabilizers, with or without mood stabilizers. Okay, they are particularly effective for manic episodes and preventing future episodes. Some are approved specifically for bipolar depression. Side effects may include weight gain, diabetic risk, and movement problems. Regular monitoring by healthcare providers is essential for the medication. Okay, so this is it. Then there is what are the therapy approaches? As I already discussed, support groups, social rhythm therapy, family focused therapy, mood tracking, skill training, and cognitive behavior therapy. Okay, I already discussed it. Then there's managing daily life. It's essential. It's the most essential part. Okay, most essential part. Okay, so maintaining your daily life is mm, very important. Is very important. Okay, so routine maintaining regular sleep, meals, exercise schedules help and stabilize moods and prevent episodes. Okay, so you need to do what, maintain regular sleep, eat regular meals, exercise daily, schedules. Okay, exercise daily, and this will help us to stabilize our mood and prevent any episode. And then there are lifestyle strategies. Take medication as prescribed and never stop without medical supervisor. Okay, maintain a consistent sleep schedule within 7 to 9 hours nightly. Exercise regular but avoid overexertion during maniac periods. Okay, limit alcohol and other illegal drugs. Practice stress managers through relaxation techniques or CBTs. Okay, keep a mood diary to track your pattern and trigger. Build a strong support network of family and friends. Okay, then there's recovery timeline. Okay, so we may cut it to the four parts. Okay, first, okay, phase 1, phase 2, phase 3, and phase 4. This is the crucial one, because in this we focus on the crisis management. Okay, or the actually happening crisis, we try to manage them. We focus on safety, medication adjustment, and stabilizing severe symptoms. Okay, Then there's second one, that's stabilization. Okay, this is a part where you accept it and try to fix it. Okay, try to but get in rhythm, try to get in rhythm with this condition and do the right things. Okay, find the right medication combination and beginning therapy sessions. Okay, and then there's skill building, where we learn by therapies and other stuff, but how we can reduce its symptoms, how we can reduce uh, its effects. And then there is, in phase 4 there comes maintenance. There's long term management, monitoring and adjustment for treatment as needed. Okay, so in maintenance all things that we learned in skill building and stabilizations, we try to implement in our long life and manage these and adjust these things accordingly. Okay, then there's supporting someone. How okay, so in this part we'll learn about how we can support someone who is suffering from bipolar disorder. Okay, okay, the first thing is education, the second thing is communication, third is practical help, and fourth is self-care. Okay, by education I mean we learn about what is bipolar disorder. When you have a concept that bipolar disorder is something that causes us us taking risky behaviors, or impulsive decisions, or other things. Once we know this, we may conclude, or by looking at our daily routine, or we can conclude that whether we have it or not, and if we have it, how to control it, how to prevent it, how to reduce it. This can be only done by education. Once you have an idea, once you know that this is something, this is a mental condition, then you can work on it. The first thing is acceptance, and acceptance will come only if you have the right education to it. And then the second thing is communication. Listen without judgment and avoid. It's we helping someone else. Okay, so this is we listen without judgment and avoid giving and unsolicited advice. Encourage treatment, but do not force it. Okay, we don't force it, we encourage it. We help them, we try to be in their shoes and mm, tell them and make them take the right decisions. Use supportive language, we use supportive language, and we avoid blaming them for their symptoms. Okay, so this is this, and then there's practical help. We need medical assistance or things, that is that. And self-care, take care of your own mental health and set boundaries. Okay, this is the most important thing you need to learn, because if you are healthy, you can make someone else healthy, right? So you need to take care of your own mental health. You can join support groups for families. Remember that you cannot fix or cure their condition. Okay, then what are the common myths that are seen in this? Separating facts from fiction about bipolar disorder. Okay. 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 It's just mood swings that everyone has, but it's not. People with bipolar disorder can't work or have relationships. Medication isn't necessary if you feel better. It's caused by personal weakness or character flaws, but it's not. Okay, it's a serious medical condition. Okay, bipolar disorder involves extreme mood changes that significantly impact functioning. Many people with bipolar disorder have successful careers and relationships with proper treatment. Medication is typically lifelong, and stopping can cause relapse. Okay, as I said, it's lifelong, and if you stop on own, it can cause relapse. Okay, it's a medical condition caused by the brain chemistry, genetics, and the environmental factors. We need to actually understand this and accept this fact. Okay, then there is crisis situation. What is a crisis situation and when is a crisis situation? Okay, then we see intermediate danger signs, thoughts of suicide or death, plans to self harm, or another severe depression with inability to function, or psychotic symptoms like hallucinations or delusions. Okay, this is a intermediate danger sign. In this, in this, we require medication, but it's not that like severe. It's in the middle. It is in somewhere middle. Okay, it's in between. Okay, in between. Then there's urgent. Then it's urgent care needed. Severe meaning episodes with risky behavior, inability to sleep for several days, substance abuse during an episode, or complete loss of touch with reality. That is depersonalization. Depersonalization. Okay, as I said, depersonalization. You cannot. You lose touch to reality. That's what happens. Okay, and in this situation, you really need help. Okay, you need urgent care, and then there is getting help. Call 988 suicide or suicide and crisis lifeline for immediate support. Nearest emergency room 911, you can call it, or contact a mental health professional as or a primary care doctor. Okay, so this is this. Then living life with living successfully with bipolar disorder, as I said, it is a lifelong condition, so we need to, if someone has it, we need to cope up with it and live our life. We cannot live our life, right? We need to move on and do things. So with proper treatment, people with bipolar disorder can lead full of productive lives. Okay, this is code by National Institute of Mental Health. Okay, so success stories. Many successful people live with bipolar disorder, including artists, business leaders, and healthcare professionals. The key is finding the right treatment combination and maintaining consistent care. Okay, consistent care is important. Recovery is possible, and million of people manage their condition effectively. Support medication. Okay, and healthy lifestyle choices make the biggest difference in the outcomes. As I said, regular sleep, 8 9 hours sleep, eat healthy, do exercise. Okay, so lifestyle choices make us what we are. Okay, this is actually something. And then is prevention and wellness strategies for maintaining mental health stability. So while bipolar order cannot be prevented, it cannot be prevented. As I say, episodes can often be minimized through proper management, or they often maximize by our wrong actions, by our wrong life decisions. And then there are wellness strategies: stick to a regular medication schedule, work closely with healthcare providers, maintain consistent sleep, learn and recognize your personal what we say uh, learn to recognize your personal warning signs and triggers. When you have education, you can categorize what triggers you the most. Why, if you are crying at this moment, why are you crying, or what's the main reason behind this? If you can observe your mood and you have the knowledge about bipolar disorder or other mental conditions, you can literally avoid them. You can literally avoid them. Maybe you can get up from them. Okay, avoid alcohol and recreational drugs, keep regular medication, as they said. Okay. This is it. Then there are resources and support, professional help, support organization, and crisis resources. As I already discussed it in the beginning, sometimes we need professional help. Only sometimes. Usually, it can be reduced by on our own if we have the right education. But sometimes we need professional help. Okay. Then support organizations. Then there's National Alliance on Mental Health, NAMI, NAMI offers education and support groups, depression and bipolar support, aliens provides peer support and resources. International Bipolar Foundation offers information and advocacy. Okay, and then there are crisis support, the 900, and these are the other things you can get to. Okay, there is employment and education. Okay, there is employment and education. The workplace rights. We need to learn about our workplace rights. The American with Disabilities Act protect people with mental health conditions from discrimination. Reasonable accommodation may include flexible scheduling or work from home options. You are not required to disclose your conditions unless you need accommodations. Okay, then there is school support. Students may be eligible for accommodations under section 504 or IDEA. Examples include extended test time, reduced course loads, or assignment extensions during episodes. Campus counseling service can provide ongoing support and crisis intervention. Okay, and then there's hope and recovery, the most important thing. And then there's hope and recovery. Recovery doesn't mean being symptom free, but rather managing symptoms effectively and living fulfilling life. Okay, what does the living a fulfilling life means? It means that you actually live your life to the fullest. By fullest, I mean you do the right things, you make the right choices, you make the right decisions mm, that make you happy and fulfilled in your life. And the positive outcomes, most people with bipolar disorder can achieve stability with proper treatment and support. Many maintain stressful careers, relationships with families. Advances in medication and therapy contribute to improve outcomes. Early diagnosis and treatment lead to better long-term results. Building a support network is crucial for uh, recovery. Self-education and education empower individuals to take control to their mental health. Recovery is a journey, not a destination. Okay, so this is it for today, guys. Thank you so much. Okay, good night.